Okay, so now we're gonna show you an example of how to do compression flossing application on the knee. There's various ways of doing this and applying it. One of the precautions you want to be prepared for is you don't want to cover the patellofemoral joint. Just because of the compression, it might actually irritate the joint more than actually helping it. Even though there's sometimes a lot of swelling, including with patients who just come out of surgery for replacements, avoid the kneecap. So go ahead and stand on up for me. We're gonna apply it in a loaded position, right below, along that tibial crest, making sure that you have a medium between this application, the compression tape, excuse me, and the skin. And you're gonna come right around to the base of where that kneecap sits. Right around there, you're gonna go ahead and pull it behind the knee, avoiding that popliteal space as well, and just go ahead and continue right above where that kneecap sits. Still, this is with a 2-inch compression tape.
Once you reach the end of the tape, you want to tuck in the ends behind the already wrapped tape.
All right. Go ahead, you can go and have a seat. We'll do some long arc quads, avoiding terminal knee extension, just to get some active motion. Stand for me, turn around, and so that's what it kind of looks like in the back. You're just having a little space along that popliteal space, and then obviously this is not the best because this should be overlapping, so everybody makes mistakes. Go ahead and turn around, and then we'll do some squats. So you always want to add in a functional component. You're looking for patellar movement, you're looking for even weight bearing and distribution to the legs. And still checking for reflow, still looking to making sure that they have all the sensation, that they're not cutting off blood, and no longer than 3 minutes. Good. Have a seat. And then take it off and reassess. Try not to pull here. Okay, go ahead and do a squat. And like I said, it's very easy to use, it's easy to roll up. In between patients, you can just wipe it down with cleaning solution, let it dry, and then roll it up, and you'll be good for another application. I'm gonna show you another way that you can also tape the knee. I'm actually gonna use 2 different types. So you have the 2-inch compression tape. You also have the 4-inch, which is very helpful in thicker areas like the thigh, just because it has a lot more muscle mass that you can cover, and then that way you're not overlapping and going through like a bunch of these. So, all right, go ahead, yeah, stand up a little there. Thank you. So I'm gonna start mid-calf, just to kind of apply a little bit more, try to use as much of that 2-inch that I have, and then I'm gonna start with the 4-inch right above through that lower quad. So, Again, avoid that popliteal space. I got some leftover, so I'm just gonna go right above that knee. Oh, or nope, see, it doesn't make it, so just gonna tie it off there. And we're gonna go for the thigh. Again, you don't want it too tight, but enough to secure. Make sure you have some lotion or medium body between the compression tape and the skin so you get better shearing and gliding. And then you tie it up. Okay, feels secure?
It does.
Is it too tight?
Not tight.
Okay, go ahead and have a seat. We'll do some lung arch quads. Very helpful if you're having patients or anybody who's getting either distal hamstring pain or tightness through that quad and just can't seem to let it go, including with knee replacement patients who kind of just have a lot of swelling. So good application. Go ahead and do a couple of leg extensions. Nice, and then we'll go ahead and have a couple of squats. Not too tight.
No, it feels good.
And if they're limited in a certain range, then you can just have them hold for a couple of seconds. Let the muscle really work. I'm gonna stand on up. Good. And then we'll take off the strap and reassess.